Hello and welcome. In this presentation, I'll be discussing professional licensure examination questions for degree level. The purpose of this is to serve as a great platform for revision, and for those who are going to write their licensure exam is to serve as a great confidence booster. Okay, we'll start with chem part. Okay, so question 1 reads that serum A comprised of the liquid component of unclotted blood. B is suitable for measurement of fibrinogen levels. C can be used for analysis of most biochemical tests on blood. And then D is obtained by taking blood into an anticoagulant and then comprises the liquid phase after centrifugation of the cellular elements. Okay, so the answer to this one is C, can be used for analysis of most biochemical tests on blood. So let's analyze our answers and see why we chose C. So basically, serum is the liquid component of blood after the cells and then the clotting proteins have been removed. So it's a liquid component after the cells and the clotting proteins have been used. So if you look at the option A, it says that comprised of the liquid component of unclotted blood. So that would be wrong, because in serum clot formation would have happened. So A is not the answer. If we look at B, it says that it's suitable for measurement of fibrinogen levels. That would be wrong, because in serum the coagulation proteins have been used up for clotting. So you cannot use serum for measuring of fibrinogen levels. Good. If you look at option C, it says that can be used for analysis of most biochemical tests on blood. That is true, that is correct. It didn't say all, it said most. And truly we use serum for most biochemical tests on blood. If you look at option D, it says that it's obtained by taking blood into an anticoagulant. So the fact that it's saying an anticoagulant means that that answer is wrong, because in serum, to obtain serum, you have to allow for clotting. So it means option D too is not the correct answer. So the correct answer for question 1 is C, can be used for most analysis of most biochemical tests on blood. Okay, let's move to question 2. Question 2 reads, biochemical tests on serum may be affected by all the following except A, exercise, B, time of day, D, diet, C, diet, D, type of analyzer used. Okay, and the answer for question 2 is type of analyzer used. So let's analyze our answer. This question is saying that would there be any change in your biochemical test result based on certain factors that may affect the serum. So if you look at exercise, for example, if you take an analyte like creatinine, serum creatinine, if you have a person who is muscular and then exercises a lot, you may have an acute rise in the serum concentration of creatinine. So therefore it means that exercise can actually affect the biochemical test results on a serum sample. Good. If you take time of the day, to time can affect your serum biochemical test result. For example, if you take an analyte like cortisol is high in the morning and then it goes down as you go through the day. So if you're measuring your cortisol levels somewhere in the morning, to be high than somewhere in the evening. So time of the day definitely affects the biochemical test results. Then if you look at diet will affect your biochemical test on serum. For example, if you measure fasting blood glucose versus random blood glucose, you realize that the results are significantly different. Fasting will be lower, and then the random blood sugar might be very high. Same for when you are doing a test on lipids. When you've eaten versus when you've not eaten makes a difference in your triglyceride value. Then the type of analyzer used. So this might not affect the biochemistry of the serum itself. So the serum itself might not be altered, even though you might have some slight alteration in precision and then accuracy of the results, but then the actual biochemical composition of the serum will not be affected directly. So based on this, the answer for question 2 is D, the type of analyzer used. Okay, question 3 says consider these statements. Refrigeration of whole blood has no effect on potassium concentration by reducing the activity of the ATPase pump. B, freezing of the blood samples will result in hemolysis and falsely elevate sodium concentration. Then C, blood for glucose estimation should be put in any tube. Then D, the concentration of many substances are the same in erythrocytes and the surrounding plasma. So the answer for question 3 is B, freezing of the blood sample will result in hemolysis and falsely elevated sodium concentration. So let's analyze our results. A says that refrigeration of whole blood has no effect on potassium concentration and by reducing the activity of the ATPase pump. So when you refrigerate whole blood, what happens is that there will be lysis of the RBCs, and when that happens, there will be release of the potassium in there, because potassium is an intracellular ion, so it will be released when the RBCs are lysed. So and then the ATPase pump, which is more or is less effective in cold temperatures, will not be able to actively maintain the potassium or the sodium potassium concentration gradient within and without the red blood cell. And so this statement is actually false. When there's refrigeration, it will have an effect on the potassium concentration. Let's look at B. It says that freezing of the sample results in hemolysis and falsely elevated sodium levels. So when you freeze a sample, actually some of the cells that lies can release the intracellular sodium into the extracellular space, but then the amount of intracellular sodium is very small, and so the final impression or the final alteration will not be so significant. That's why B is the most likely answer in this set, because even though the sodium concentration can increase when there is lysis of the cell, it's not that significant. The increase is very slight, and so it's not that significant. Okay, it says that C, blood glucose for estimation should be put in any tube. So this statement is false. Blood for measuring of glucose should be put in a fluoride tube. That can number one, prevent anticoagulation, and then prevent coagulation, and then also preserve the glucose from being used by glycolysis. Okay, then D, the concentration of many substances are the same in erythrocytes and the surrounding plasma. So this statement is false. If you take, for example, potassium is more in intracellular space than the extracellular space. So that's about that for question 3. Then question 4, it says that blood sample for blood gas is collected into A, dipotassium EDTA tube, B, fluoride oxalate tube, C, lithium heparin tube, and then D, sodium EDTA tube. Okay, so the correct answer for this is lithium heparin tube. Lithium heparin tube is the correct answer because the lithium heparin prevents coagulation of the blood, and at the same time is able to preserve the blood gases. If you look at dipotassium, that's option A, and option D, sodium EDTA, they may be able to prevent coagulation but will not preserve the blood gases well. Fluoride oxalate tube, that's the B option, is used for preserving glucose and not blood gases. So the right answer for this question is C, lithium heparin. Okay, question 5. It says that serum electrolytes are accurately measured by which of the following methods? So it says A, cation elective electrode. Cation selective electrode. Then B, anion selective electrode. C, ion selective electrode. Then D is ion selective electrode. Okay, so the correct answer for this is D, ion selective electrode. Okay, so ion selective electrode is the best method for measuring serum electrolytes. And option A and option B are almost the same thing, but they are more specific. So you'll be using the cation to be measuring something like sodium and potassium. So cation selective electrode will be measuring the sodium and potassium, and then the anion selective electrode will be measuring like the chloride. But in this question, it's a more general something, so we'll go for ion selective electrode. The ISE. Okay, the option C is just more like the wrong spelling sort of, or the wrong word being used. Okay, so the correct answer for this is option D, which is ion selective electrode. Okay, question 6. It says that the general quantitative relationship that governs all absorption processes is known as A, the Nernst law, B, Faraday's law, C, Beer-Lambert's law, and D, fluorometric law. So the correct answer here is C, Beer-Lambert's law. Okay, so the Nernst law is actually related to electrochemical potential. Faraday's law is also pertains to electrolysis, but then Beer-Lambert's law is what actually relates to the absorbance of substances. So the law is just saying that the absorbance of a substance is directly proportional to its concentration. So that's the Beer-Lambert's law. So the correct option for question 6 is C, Beer-Lambert's law. Then D, fluorometric law. Fluorometric law is associated to fluorescence measurement. So where there is fluorescence emission, that concept, that's where this fluorometric law applies. Okay. Then question 7, it says that point of care testing A eliminates the need for training staff who use these instruments. B, cannot be used to measure bilirubin. C, is best estimated independently from central biochemistry lab. And then D, is less costly per unit test than analysis undertaken in the central lab. So the correct answer for this question is B, cannot be used to measure bilirubin. Okay, so let's analyze our answer here. Option A says eliminate the need for training of staff who use these instruments. Though point of care testing is supposed to be easy and sort of convenient for use, it still does not eliminate the need for training to get accurate results. So you cannot totally eliminate the need for training. Okay, then B, cannot be used to measure bilirubin. Yeah, that's the answer we are choosing for question 7. That is because as far as we are talking now, there is no point of care device that is used to measure bilirubin. All bilirubin measurements are being done in the lab using a biochemistry analyzer. Okay, option C says it's best established independently from the central biochemistry lab. That will be incorrect, because no matter how good a point of care testing device is, you still have to somehow cross-check with central lab results. So once a while you need to cross-check to serve for purposes of accuracy and precision. So you'd need that. Then option D says that it's less costly per unit test than analysis undertaken in the central lab. That's also false, because for point of care testing device, you realize that because you are doing the test once a while, you realize that it's more costly than labs, the same lab being done in the central lab, where there's large numbers, and then it actually brings down the cost per unit. So point of care testing device may be more or relatively expensive than labs done in the central lab. Okay, so the correct answer, or the answer we chose for question 7, is B, that cannot be used to measure bilirubin. Okay, question 8. The urine of a healthy person should contain the following analytes: A, glucose, B, creatinine, C, protein, and D, bilirubin. So the correct answer for this is creatinine. Yes, if you look at option A, glucose, when you have glucose in your blood, it means you are not healthy. This is usually associated with diabetes mellitus. Okay, which will now occur when the glucose level exceeds the renal threshold. Then you see glucose in urine. It's not a good thing at all. Then creatinine, yes, healthy people have creatinine in their urine because that's the function of the kidney. The function of the kidney is to eliminate creatinine, which is a metabolic waste product from the body. So that is the correct answer for question 8. Protein. So normally you have minimal amount of protein in your urine sometimes, but then significant proteinuria is associated with kidney issues. Kidney issues. So it's not something that is also very common in healthy people. Okay. Then bilirubin. Usually you will not find bilirubin in urine. We will not find bilirubin in urine. If there is usually bilirubin is associated with liver and liver diseases, so you won't find it in urine. Okay, so the correct answer for question 8 is B, creatinine. Okay, question 9. It says that variation in water levels in humans could be due to any of the following except A, age, B, environment, C, gender, and then D, water intake. Correct answer for 9 is gender. If you take age, for example, we realize that infants and young children have higher percentage of body water compared to adults, and then they elderly usually have a lower body water content, and so depending on your age, you might have variations in water content. Then if you take environment also can cause variation in water levels in humans, because if you stay in a place where there's high temperature and humidity, you realize that you lose water more quickly through sweat, and so there will be variation in water levels. Then if you take gender, that's the answer we are selecting. We're saying that gender will not affect water variation significant, because whether you're male or female does not really influence the water levels in your body. So the difference in body water content between male and females is related more to body fat percentage rather than the gender itself. And so while gender can influence body composition, the variation in water levels between the gender is not as significant as other factors. So that's why we are selecting option C. Then water intake. Yes, water intake directly affects hydration levels. And increased intake can improve hydration, while insufficient intake can lead to dehydration. So the answer for question 9 is C, gender, which we're saying that it doesn't really affect the variation in water levels in humans. Okay. Question 10. It says that which of the following statements is true about osmolality? A is a measure of the number of moles of solids per liter of solvent. B, its unit is usually osmoles per kilogram or millimole per kilogram. Then C, the physiological normal osmolality is 247 to 295 millimole per kilo. And then option D, the recommended clinical formula is 2 times the concentration of sodium. So the correct answer for number 10 is B. Its unit is usually osmoles per kilogram or millimole per kilogram. So let's look at osmolality. Osmolality is the number of moles of solids per kilogram. So is the solids per kilogram of solvent. So option A says that is the measure of the number of moles of solids per liter of solvent. So because there's liter there, that answer will be wrong. Then B, it says that osmoles, the unit is osmoles per kilogram, that is correct, or millimole per kilogram. Then physiological normal osmolality is 247 to 295 millimole per kilogram. This value is wrong. It's slightly lower than what is expected, so it's not correct. What we expect is 275 to 295 millimole per kilogram. Then D, the recommended clinical formula is 2 times the concentration of sodium. That's also not correct. The formula for osmolality usually will include glucose, urea, and then sodium. The formula is there if you want to check, and check it on the internet. Okay. Then question 11. Question 11 says that hyponatremia A is usually due to excess sodium loss. Then B is not commonly seen after surgery or trauma. Then C, in the syndrome of inappropriate secretion of ADH, is associated with low urine osmolality. Then D may be due to hyperemesis. The correct answer for this is D, may be due to hyperemesis. So hyponatremia is where there is decrease in sodium concentration in the blood. And option A is saying it's usually due to excessive sodium loss. So actually, naturally, you would not be losing sodium. So the loss of sodium is uncommon. What happens is that there is dilution of sodium due to water retention. That's usually what leads to sodium or decrease or hyponatremia. So option A is unacceptable. It's wrong. It says that usually loss of excessive sodium is usually due to excessive sodium losses. So that's unacceptable. So B is not commonly seen after surgery or trauma. That's also not correct, because usually during surgery there is fluid administration and the release of ADH, which can also cause water retention. So that commonly happens during surgery. So but the option is saying that it's not commonly seen after surgery, so that would be unacceptable. Then in the syndrome of inappropriate secretion of ADH, the syndrome of inappropriate secretion of ADH, what happens is that there is excess secretion of ADH, which causes the kidneys to retain water, which will actually dilute the sodium. But then the urine osmolality will still be high. That's the nature of this condition. But then the answer is saying that with low urine osmolality. So that's where the makes the whole thing wrong. Okay, then D may be due to hyperemesis. So option D is correct, because when there is hyperemesis, you would lose a significant amount of sodium and then fluid, which compounds to dehydration and electrolytes imbalance. Okay, so that's about that. So that's question 11. That's the answer. Let's move forward. Question 12. It says that estimated GFR as glomerular filtration rate. A is valid in all age groups. B is a useful assessment of the progression of acute renal failure. C can be used to assess renal function in pregnancy. And D is the basis for clinical classification of chronic kidney disease. So the answer for this one is D is the basis for the classification of chronic kidney disease. Okay, so let's analyze the answer. Usually it says A is valid in all ages. That would be wrong. Usually for young children and then in the elderly, GFR may not accurately reflect renal function due to variation in muscle mass and other factors. So the value for very young children would not be very accurate. Then B says it's useful for assessment of the progression of acute renal failure. Usually when there is renal failure, when there is a acute renal failure, the eGFR may not show much significant difference, and so it's not really useful for acute renal failure. Then C says that can be used to assess renal function in pregnancy. That's also incorrect, because in pregnancy there's some of the physiological changes actually causes an increase in blood volume and then glomerular filtration rate, and so this parameter will be falsely increased, which will not reflect the actual assessment of the renal function, and so eGFR may not be helpful in cases of pregnancy. Then D, which is our answer, it says that it's the basis for classification of chronic kidney disease. Yes, that's very, very true. In CKD, one of the parameters that we use to stage them is the estimated GFR. So That is our answer for question 12. Then let's move to 13. In order to determine the glomerular filtration rate, one must estimate the following: the plasma volume, the plasma BUN concentration, the plasma volume over a specific period of time, then the urine concentration. The correct answer for this is the urine concentration. The urine creatinine concentration. I don't know why they wrote it this way. So the urine creatinine concentration. Okay, so this is the what do you call it? This what you need to actually measure the eGFR. So the correct answer for this one is C. So eGFR basically measures how well the kidney is filtering blood. So creatinine clearance commonly used method to estimate the eGFR. Let's move to question 14. It says that plasma creatinine A is a useful screening test for the presence of renal tubular disease. B is often reduced in patients with hepatic failure. C is unaffected by changes in diet. And then D, assay may be subject to interference. So I just went straight to the answer part. So question 40, the answer is D, assay may be subject to interference. So let's analyze our options. We're saying plasma creatinine A is useful screening test for the presence of renal tubular disease. In renal tubular disease, the plasma creatinine might not be so significant. Other analytes may be more helpful than that. The plasma creatinine may be more useful when analyzing glomerular filtration or assessing the overall kidney health, but not the renal tubular disease. Okay, then so A is not accepted. Then B is often reduced in patients with hepatic failure. So hepatic failure is liver failure. Usually liver failure does not really result in any significant change in plasma creatinine. Then C is unaffected by changes in diet. That is also false, because what do you call it? Creatinine, which is a byproduct of muscle metabolism. When somebody is on a high protein diet, this will actually increase the creatinine levels. So this statement will also not be true. Then D, assay may be subject to interference. Assay may be subject to interference. Okay. Sometimes when you are assaying for the creatinine in a sample and then the patient is on some medication, it can also sometimes cause certain interferences. So that's why we are selecting option D as our answer. In 15, electrolytes in the body included the following except A, sodium, B, zinc, D, C, chloride, and D, potassium. So the correct answer here is B, zinc. So the electrolytes are mainly sodium, chloride, potassium. Zinc is usually not considered an electrolyte. It may have useful biochemical functions and then some enzyme activity, but it's not considered as this one. What do we call it? As an electrolyte. Drink some water. Okay. Question 16. Which of the following is a cause of metabolic alkalosis? So A, starvation, B, diabetic ketoacidosis, and then C, severe diarrhea, D, antacid overdose. So the correct answer here is antacid overdose. In metabolic alkalosis, the pH of the blood increases. due to metabolic reasons. Okay, so if you take starvation, for example, when you are starving, there will be beta oxidation, so keto acid to be produced. This will actually lead to acidosis. So that this answer is not acceptable. Then if you look at B, diabetic ketoacidosis, the keto acids also leads to metabolic acidosis. Then if you take severe diarrhea, in severe diarrhea, you actually lose bicarbonates, and when you lose bicarbonates, it will actually lead to rather metabolic acidosis. Then option D says antacid overdose. Yes, when you overdose on antacids, which contain bicarbonates, when you take excess of them, it can lead to metabolic alkalosis. Okay. Question 17 says that the cause of respiratory acidosis includes all the following except A, salicylate toxicity, B, respiratory depression, C, chronic airway obstruction, and then D, overdose of anesthetics. Okay, the correct answer for this is salicylate toxicity. So respiratory acidosis is when how do I even say this? It's when there's accumulation of carbon dioxide in the blood due to inadequate ventilation. So we are not releasing the carbon dioxide well, so they are accumulating in the blood, and it will lead to respiratory acidosis. So the question is saying that all these can cause it, except we are saying that the exception here is salicylate toxicity, and this actually typically leads to metabolic acidosis, but not really respiratory acidosis. Yes, not really a respiratory acidosis. Okay. If you take respiratory depression like that, when there's the respiratory system is depressed, it means that you will not be able to ventilate well, and so there will be retention of CO2 in your body, which can lead to respiratory acidosis. Same for chronic airway obstruction, where you are not, or your exchange of CO2 is being impaired, and so it will be retained and lead to respiratory acidosis. Then overdose of anesthetics, that's the word. Interesting. So certain anesthetics can actually cause the respiratory system to not function well as they should, so it could cause a depression of the respiratory centers, and when that happens, it could build up CO2, and then it will lead to respiratory acidosis. Okay, so the correct answer for this one is A. Question 18. Which of the following substances can be used in the measurement of glomerular filtration rate? A, inulin, B, albumin, C. So question 18. Which of the following substances can be used in the measurement of glomerular filtration rate? A, inulin, B, albumin, C, creatinine, and D, bilirubin. The correct answer for this is creatinine. And if you look at inulin, the inulin can be used as that you have to infuse it intravenously. That makes it very complex and then costly. If you look at albumin cannot be used to measure EGFR. You cannot use to measure if you are even having albumin in your urine. It's a bad situation for you. It may indicate kidney damage. Bilirubin is not used to measure GFR2. So it's hardly related to the kidney. So the correct answer here is creatinine, which is very suitable for this purpose because the waste product of muscle metabolism is completely filtered and not reabsorbed. Okay, question 19. Serum urea can change independently to renal disease in all the following except A, high protein intake, B, overhydration, C, burns, and then D, congestive heart failure. And we say that the answer for this is B, overhydration. So we're saying that high protein intake, that's the first one. So increasing serum urea increases serum urea levels because urea is a byproduct of protein metabolism. So consuming high protein diet can elevate urea levels as much as protein is broken down in the liver. Then if you look at option B, typically overhydration typically dilutes serum urea levels rather than elevating them. So when there is excess fluid intake, the concentration of urea in the blood decreases because of the increase in the volume of fluid that it dilutes. So that will be our answer. Then C. So burns can cause increased serum urea levels due to significant protein catabolism and then increased nitrogen loss from damaged tissues. Then if you look at congestive heart failure, so congestive heart failure can lead to elevated serum urea levels due to reduced renal perfusion and decreased kidney function. So from this, overhydration is a condition among the choices that would not independently lead to an increase in the serum urea levels. Hope you get it. Question 20. It says that which of the following is observed in the Zollinger-Ellison syndrome? A, gallstone in less than 20% of all cases. B, more females are affected than males. Then C, gastric acid output is decreased. D, excessive production of acid by the stomach. The answer to this one is very straightforward. It's D, excessive production of acid by the stomach. So Zollinger-Ellison syndrome is a tumor that causes the stomach to produce excessive acid. So the answer is straightforward. If you know the condition, you know the answer directly. Okay, question 21. It says factors to consider in selecting a plasma enzyme for diagnosis include all the following except A, sensitivity, B, specificity, C, half-life of the enzyme, and D, molecular weight of the enzyme. The correct answer here is D, molecular weight of the enzyme. So for any as the sensitivity and specificity is very important. So sensitivity will relate to the ability of the enzyme to detect the presence of the disease when it is indeed present. Then specificity will be the ability of the enzyme to test the ability of the enzyme test to identify the disease correctly and not affected by other conditions. Then the half-life of the enzyme, that's the duration for which the enzyme remains in the bloodstream, which can affect its detectability and relevance in diagnosis. However, option D, which is molecular weight of the enzyme, is really not a primary factor since in the section of primary enzyme for diagnostic purpose. So molecular weight is a no, it doesn't really affect the diagnostic purpose. Okay. Question 22. The activity of plasma enzymes can be affected through all the following except A, the rate of release from the target organ, B, distribution of the enzyme in extracellular fluid, C, the size of plasma enzymes. D, the rate of elimination of plasma enzyme. Correct answer here is option C, size of the plasma enzyme. So if you look at the options, yes, the rate of release of an enzyme from the target organ can really affect the activity of plasma enzyme. Yeah. Then the distribution of enzyme in cellular fluid also can affect it. It shows how much of it will be available in there. But then the size of the enzyme does not really matter here. It does not impact the activity of the enzyme in any way. Then the rate of elimination of the plasma enzymes, yes, very, 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 very important. That's how long the enzyme remains before it's been removed from the bloodstream, and then how fast that happens. Okay, so the answer for question 22 is C, the size of the plasma enzyme. Okay. Whoa, we are almost through. So let's do this case study and then we're out of here. So a 23-year-old female had her fasting plasma lipids checked by the family doctor because her father had been admitted at the hospital and diagnosed of myocardial infarction. Age 44. Her lipid profile results are as follows. The biomedical scientist had the optical density of the triglyceride to be 0.09, mean standard absorbance to be 0.20, and the standard concentration to be 2.28 millimole per liter. So this is a table showing us the values. The cholesterol is 9.40, which is very, 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 very high. HDL is 1.2 millimole per liter. Then the trig is not there. They want to quiz us on it. Okay. So the first question: what is the triglyceride concentration from the above case study? To get that, you would take the optical density of the triglyceride, that is 0.09, over the standard, that's 0.20, then multiplied by the standard concentration, which is 2.28. So that when you do that calculation, you are supposed to get 1.03 millimole per liter. So that's the answer for question 23. Then 24, calculate the LDL of the above equation. To get that is total cholesterol minus the HDL minus the VLDL, and to get VLDL is the triglycerides divided by 2.2. So when you do that calculation, you're supposed to get option D, 7.73. Then it's also asking, last question, very low density lipoprotein concentration of the patient is the triglycerides divided by 2.2. If you do that, you're supposed to get 0.47. Okay, so that brings us to the end of the session on chem part. Watch out for part 2, which is on hematology, also 25 questions. Thank you and good luck.